We've all been craving getting together with our loved ones and being able to be together, especially without wearing a mask. It's important to know that if you are vaccinated and those that you love are fully vaccinated, you can visit each other without wearing a mask or without social distancing. Once we're visiting households that have unvaccinated or vaccinated people together, we want to make sure that we're extra careful with our visits. It's okay to visit as long as you take precautions when you do. The CDC has recently issued guidelines for fully vaccinated travelers here within the United States. They have said that if you are fully vaccinated and take precautions, it is safe for you to travel. Anytime any member of our family is unvaccinated, we want to do everything we can to protect them from getting the disease, no matter what their age is. And this includes for our children. So if your children are going to be engaging in social activities, please make sure they're following all the local health guidelines and doing everything we can to keep them as safe as we can from the COVID-19 infection. It is so important that we look to see the signs of stress and anxiety in all members of our family, including our children. This year has been a hard year for all of our children, including mine. As a mom and as a pediatrician, I want to make sure that we're all reaching out to our children and doing what we can to help them navigate the anxiety and stress that comes with the pandemic. It has not missed our children. Our children have taken a huge toll from this. They have missed time with their friends. They have missed time in normal social activities. I want to make sure that we can reach out and discuss this with our children in the most age-appropriate way that we can. Have open dialogue with your children as appropriate. Look for signs and stress, which can relate from anything from behavioral changes, school changes, temper tantrums in younger children. Anything that you think is different, please take the time to reach out to your pediatrician or your provider and see what we can do to help support your children. We are all getting more and more information about the variants that are spreading locally here in our communities as well as worldwide. As we continue to fight this pandemic, it's important to remember that the most important tools we have against fighting COVID-19, including the variants, are the vaccine and everything we can do to protect ourselves, including social distancing, wearing a mask, and washing our hands. The best information we have now, the vaccines are very effective against the variants of COVID-19. So as we continue to go through the pandemic and get more information, it is so important that we continue to keep the battle going and get everyone vaccinated as soon as we can. Currently, all major manufacturers of the COVID-19 vaccine are performing clinical trials for children as young as 6 months old. These are rigorous scientific studies that take into account all the safety and efficacy of these vaccines in our youngest children. Only after the trials are finished will they have some information and be able to give us advice for how to use the vaccine for our children. I do believe these vaccines will prove to be safe and effective in this population, and as soon as it's evaluated, they will be released for public use.